Hi, welcome to Lisa Moss Medicare, and welcome back for those of you that have been watching this series on YouTube over the past many weeks. And anybody that's watching for the first time, welcome. We're all about Medicare here and Medicare education because remember, you're the consumer and you're the one that worked all these years for your Medicare. So I'm Lisa Moss. I am not affiliated with the US government and I do not work for the Office of Medicare. I'm what's called a broker. I'm brokered with all the different agencies in my area. I live in Idaho and I'm licensed in several states. And I go and look for the best policy for you. Because remember, all the policies are different. They all have different formularies and they all have different benefits because everybody wants something different. And I want to remind you, and I'm going to remind you every week that we do this until open enrollment, which starts October the 15th, is be sure to check in with myself or your agent this year because we're going to have a really weird Medicare season this year because there's a lot of changes coming up for the 2025 season. So remember, if you have a Medicare Advantage plan or a standalone drug plan, those plans, you can change them October 15th through December 7th to be activated January 1st. So you want to make sure this year that you're doubly sure to check in to make sure there isn't any big changes. You will receive legally in the mail every year an annual notice of change letter that comes around September. And I would suggest reading it this year. A lot of people just toss it or they don't pay any attention to it. Super important. And I'll do updates for you at the beginning of October. I can start talking about all the different company updates as of October the 1st. Today, we're going to talk about Medicare scams. Whether you like it or not, it could happen to you. And you've probably heard of many people that it has happened to some type of scam by the internet. So I am just going to put my glasses on here so I can read a few notes for you. So I want you to take extra precautions, and I'm going to give you some suggestions on how to do that. So the first thing is I want you to treat your Medicare card, your red, white, and blue card that has your Medicare number and your A and your B start dates like a credit card. You don't want to give that number out just to anybody. You want to keep it in a safe place. You don't want to lose your card. If you do, you can get another one on the Medicare site at medicare.gov, and they'll send you another one. You can laminate the card. That's a question I get a lot. And yes, you can laminate the card, but treat it like a credit card. And don't accept offers that people offer you for free gifts in exchange for your information, for your Medicare number, or anything to do with your Medicare. Gifts or money are not allowed, so do not fall for that. And don't accept services that aren't usually covered by Medicare. You know, only your doctor trusts them with the information in your doctor's office. You can trust your agent, somebody like me that works with you and knows the system and will keep that information safe. We're required to make sure that our computer is safe at all times and all your information is safe with us as well. Don't forget that Medicare will never call you for your information or to update your information. So if you receive a call in the mail first or on your phone, first off, you'll never receive a call from Medicare to update anything. Your agent may call you, your company may call you that your policy's with, but if another company calls you or some random person out of the blue calls you, just know, no, do not give them your information. Again, keep that information private. So some common scams that do happen is there's called the grandparent scam, and they will call you and they're using AI now to kind of scam the voices of your grandchildren or your children to say, hey, grandma, give me your information. Well, no. Do not do that. Meet them in person or just know and verify that's them, that that's their phone number online that they call you. Um, Medicare coverage helplines, commercial or advertising helplines on the TV, like the 1-800 numbers, do not fall for that, especially when they say, oh, we'll give you lots of food benefits or we'll give you all these extra benefits. Usually you have to have low income subsidies, be on Medicaid, and there's all kinds of scams out there with that. So do not fall for these 800 numbers, for these people that you see on TV a lot that are movie stars that are attempting to sell you anything with Medicare. They are scams. They're only trying to get your money and your information. There's also fake websites that come up on your computer or on your phone, and there's targeted ads to say, we'll give you all this information. It's got to say HTTS semicolon, not just HTTS. So I know there's little things like that you can see, but if you think it's a scam, if it just pops up on your phone, it's not your agent, it's not your doctor, it's not the company that you have your policy with, buyer beware. I would definitely not go for that. And then there's always phone callers. Nobody is allowed to call you unless they're your agent, they're your company, or they're your doctor. If they're calling you out of the blue, they're not allowed to do that. They have to have your signed permission ahead of time for them to call you, and to even write you. They can write you letters, they can send you emails, but they can't hang something on your door. They can't give you a call. They can't, a lot of times they'll call you and they'll go, hey, can you hear me? Can you hear me? It's a scam. Just know that your information is really valuable, and especially your banking information. If they ask you anything about your routing number, your bank account, your banking information, it's a scam. Okay? And call me first. I have so many clients that call me out of the blue and say, Lisa, this is happening. In fact, I have at least 1 to 2 calls a week. I had one this week that I met with a lady over in another county, and I was just talking to her randomly about her Medicare. I have her number and her address and her phone number, but I don't have any of her Medicare information. And she received a letter in the mail that stated that they're changing her Medicare. And it was from Social Security, and then she got another one from Medicare. And I said, no, we didn't change anything. We didn't do anything for you. You can check in with the agent that you used to have and see if he did anything, but I don't think so. Double check with me, call me, let me know what's going on. You can take a picture with your phone, and then you can text it or email it to me, and I can take a look at it. And I'm pretty good at sleuthing out those scammers out there because it just makes me mad. I am here to serve the seniors and the veterans with your Medicare. I've learn more and more all the time and educate myself to be an expert in the field of Medicare and Medicaid, to understand what's going on so I can help you, because you're the consumer. You work for this and you have a policy and you bought this all those years ago from your hard work. There is an enrollment period that's coming up, like I said, October 15th through December 7th. In order for an agent to talk to you, you have to give them written permission of exactly what you want to hear about. Do you want to hear about drug plans? Do you want to hear about Medicare Advantage? Do you want to hear about supplement plans? Do you want to hear about hospital plans? You tell them what you want to hear about, and that's all that they're allowed to talk to you about. So remember that. You have to put it in writing, and your agent, or myself, if I'm your agent, will contact you and will send you, it's called a scope of appointment. It's good for 1 year in order to talk to you about Medicare. Anybody that calls that says there's all these extra benefits, buyer beware. They're actually cutting back this coming year on 2025. So you want to know what's available to you. If they cut a lot of your benefits, definitely call me. Let's view all the different policies along with your medications, make sure they're in the formulary, and see if there's a better policy for you. If your supplemental insurance is going skyrocket high, also call me. We have the birthday rule here in Idaho. Your birthday and 63 days later, you can change your supplemental plan and possibly get the same coverage for less money. Agents can't come to your home without an invitation, so they can't just come knock on your door, leave paperwork for you on your door. That is not allowed. It is illegal. Same with leaflets on your car. You already have to have a relationship with them for them to contact you. And you want to make sure that whatever you do, you also have an explanation of benefits. Now, I am going to put some information on the screen. This is how to get in touch with me. If you have any questions whatsoever, give me a call, 208-544-5011, or you can email me through my website, insuranceover65.com. Also, on the website, if you look under articles, I have written 50 articles now. Pretty proud of that. 50 articles all about Medicare. So if you have questions and you don't feel like picking up the phone, go to the website. You'll probably get your answer, unless it's some weird thing that's happening with your Medicare. On the website, there's a lot of general information about the birthday rule, about even the scams that we're talking about today. There's more detailed information on the website, Insurance Over 65. Well, I'm going to check in and see if anybody wrote any comments or questions. I don't see any today. We go live every Friday. We are going to be live next week, and then we'll take a week off. I'm doing one of the fairs, so I'll be live at the fair, but not on YouTube. But next week we will be here. You can tune in live and ask questions, or you can always re-watch these on YouTube. Before I go, we just did get a question about the Medicare booth at the fair. Well, I'm going to be at the Jerome County Fair here in Idaho from Tuesday, the 6th of August, until Saturday. So for 5 days from, Tuesday, Wednesday, Thursday, I'll be there from 4 to 10. Friday and Saturday from 12 to 10 hours. And I'll have lots of giveaways to give to people and to give to you. So come by and say hi at the Jerome County Fair, August 6th through the 10th. So thank you very much for enjoying the podcast today on YouTube, and we'll see you next week. Until then, have a great week. Thanks so much. Bye-bye.